So hello everyone, this is Dr. Erdogan by Smile Hair Clinic. We would like to show you some of the patients that we did before 2.5 years ago. I would like to give the treatment plan and the outcome of the patient. So let's start very quickly from patient's photos first. Our patient is 24 years old, he's from UK, he has a Afro-African background. When we check his first photos that we take in the studio, it's not quite well with the light probably. We have in the operation room much better photos actually. But once we check his photos right now, he needs something in the frontal part, especially the frontal part. His request was to a very straight line that is fit on his face. So we did this planning in the room. After these photos, I will show you the operation room photos as well. His donor area seems okay in this photo, but every time we tell this to the patients that the lighting, the photo resolution, the camera angle, the room, everything just gives us a different perspective and a different opinion about his condition. So let's check his operation room photos. That he needs just small temporal recession, just he needs to fill in. I think in the mid scalp and in the crown area he has also some gaps, but the concentration we concentrate on his frontal part. He just requested the frontal part, so we did his planning in the frontal part. Of course, in every race, every background, we have different decisions for the hairline. So for Asian hairlines, we give some different hairline levels, or for Caucasians, we have different. And in the Afros, we usually decide according to the patient's skull and also patient's request. Sometimes they want some more facial hairlines. So as you see, we just did a very frontal part, and in his condition, because he wants a little lower ring effect, we also did some temporal point too. Usually I do not want to do so much temporal point to every patient, because sometimes it's very, if the patient is a thick hair, it looks very noticeable that it's unnatural. So I prefer more to do with Caucasian hairs, with thinner hair, or with afros. If it's very curly, I'm doing the temporal point. So his need was just a little bit to continuation of the line, so we drove some his temporal point too. Let's check his donor area. I think the most important factor in this kind of patients is usually whatever we see is different than our routine extraction type. So the most difficult part is the extraction part because of the hair textures and hair type. We have sometimes C or J level hairs, which is more hard to extract, and sometimes we have more transaction rates when we are extracting them. So we do not want to take too much, by the way. With lower graft number, we have a better result with the patient. So we targeted 1,800 grafts with him. We did the incisions first because his need was too little in the front. That's why we did 1,800 incisions, and we extracted the same graft number. I will show you the shaved photos right now. Okay, here. I think in the left temporal part, he has a small scar, a different coloration in his face. But it doesn't matter, we do still the operation. Okay, let's check out his implanted photos. Okay, so this is from the top appearance. You see that we just concentrated mainly in the hairline. We feel the bald part. I told you, and I'm repeating one more time, we do not do so high density in this kind of patients. And I think we shouldn't do too much density with every patient also. Of course, if it was a Caucasian hair, according to the hair's caliber and hair's thickness, we usually 50 to 55 follicle units per centimeter square, but I decrease this density in the Afro patients because we know that when it grows, it covers more area than it is. So I think the technicians or the doctors should know one thing, that The density is not important unless you get the right density outcome. So you will see in the photos that it might not look very dense in the transplantation photo, but the outcome photo is very good, I think. Some small temporal point too, I'm showing you as well. It's just 1,800 in the front. If the same area with another hair texture, probably it would be ended up with 3,000 grafts or a little bit more. Okay, this is also from another perspective. This is from another perspective too. After that, what happened to him? I think one of the things that the patient has in common with the Afro background, it's not very visible after the operation. I mean, with more blonde people, I think it's very visible with the appearance, but with the Afro background, it is very good, a good recovery period. So that is the 13th day photo. This is the first month. You see, it's pretty much not well. I mean, it's similar to his condition, but just a short hair. So it's he is in the shockless period right now. So third month, yeah, he has a better appearance actually. It looks very good. I think he also used some fibers to hide at that time. That's the reason there's a coloration. Okay, 6th month. 6th-month photo is also very good. I mean, even we got the result at that time, I think. Let's check how it's in the 9th month. Okay, very good. So transition from the temporal point looks good. Temporals are filled already. Maybe still some need of density there. Very good, perfect for his face. After 9th month, it starts, but we see more thickening at that time. And this is the 12th-month photo. It is perfect, I think. I really like the result. I'm so pleased about him. Here it's another one. By the way, in the extracted areas, it looks very good. Front looks very good. You see, I mean, it's very good with that density, and it's very good for that number, I think, 1,800, in order to remember. Yes, that's all. Maybe it's more irregular, and I think he shaved some of the hairs here, so it's more straight looking. But I think it is good for his face and for his frames, and he has a good forehead right now. Thank you for watching our video. I think this will help for you to understand the principles of some hair transplantation. Thank you.